working on developing a system to detect jet, or when these arrhythmias were occurring. And it's particularly challenging in pediatric cardiology patients because the data is quite noisy. The heartbeats are a little bit less stable in this type of data, so it's hard to understand whether an actual arrhythmia is occurring or this is normal kind of fluctuations in the ECG channels that are being recorded. So this project, we had a team of students working on this project actually for about a year and a half, and some students continued on it the whole time. This is a research project. Some students joined, so a total of around 12 students worked on this project, and they did a fantastic job. Several of them, I should mention, are publishing, so I believe they've submitted 3 research papers based on the results in collaboration with cardiologists from Texas Children's Hospital. And what was unique about this project was that most arrhythmia detection systems that are used are based solely on ECG data or electrocardiogram data. And the challenge with that is, what if some of those channels become corrupted? Then suddenly you can't use those models, and those models are not particularly predictive. But in clinical settings, they're actually recording a lot more data than just ECG. For example, there might be central venous pressure, AVP data, other types of data. And so the idea was to, can you integrate all of this data and build a more robust and reliable predictive system for arrhythmia detection than a model that just relies on ECG alone? And what they discovered was yes, actually you can. Using these additional data sources, you can get better detection than just ECG alone, but particularly if any one data source becomes corrupted for any reason, there's reliable information in the other data sources that can still sound, an alert if an arrhythmia is occurring, so that clinicians can intervene.